Time now for our Lifeline report, and one of the many inadequacies of this nation's health care system, the fact that millions of Americans with serious health problems end up with serious financial problems as well. Our chief medical editor, Dr. Nancy Snyderman, reports on how patients are turning to credit cards to save their medical bills.
Peggy Sherry is a cancer survivor. Her treatment took 2 years, but even with health insurance, she was left with $40,000 in uncovered medical bills.
I would wake up and say, oh my God, I have cancer. And then the second thought is, how are we going to pay for this? Bills and bills and bills.
After depleting her savings, Peggy charged the rest of her medical expenses, some $10,000, to her credit card. It's a practice that's becoming more common. 36 million Americans have medical debt. Cindy Zeldin works for Demos, a nonprofit research and advocacy group. She says even the insured are not immune from this growing trend.
The direction of health insurance is towards greater individual risk, greater out-of-pocket expenses, and those expenses are going right onto credit cards.
Enough that 29% of low and middle-income households with credit card debt have medical bills to blame. These households carried an average of $11,000, compared with $8,000 for those without medical debt. Healthcare experts counter that hospitals are also in a tough position.
The high deductible health plans are causing hospitals to have to collect more up front. They are worried about the fact that patients will need treatment, but yet they won't have the money to pay up front.
With health care costs rising faster than incomes, more families are at risk for financial trouble. More than a third of all personal bankruptcies are related to medical debt.
We shouldn't have to worry that we're going to bankrupt our family.
In the end, Peggy paid off her card with an inheritance. She says no one should have to choose between financial security and good health. Dr. Nancy Snyderman, NBC News, New York.